Tammy Whelen is an educator at the Canadian Mental Health Association, Peel Dufferin, and focuses her efforts on helping to spread the word about mental health issues that affect so many Canadians from all walks of life. She is Certified ASIST Trainer, Applied Suicide Intervention Skills Training, Certified safeTALK Trainer, Compassion Fatigue Trainer, and a Mental Health First Aid Trainer. She also has a certification in Facilitation and Teaching Effectiveness and Adult Education. Tammy shares her knowledge and expertise as an instructor at Humber College and is determined to demystify mental illness and fight the stigma surrounding it. Today's webinar will be recorded and all participant lines will be muted. You will be able to see her presentation in video in the window. You can ask questions in the chat window by clicking the chat icon at the bottom of your screen. We will have a 5-minute Q&A session after her presentation. Avanti Women is offering attendees a one-time online learning coupon for access to 32 different courses offered by Harvard Business Publishing in appreciation of their support and commitment to self-development. Without further ado, I now pass the presentation over to you, Tammy, and I'm just going to make you the host now.
Great, thank you so much.
And you may begin.
All right, great. So welcome everyone. It is a pleasure. Happy Wednesday night. I am here to talk to you about mental health, what mental health is, how we can appreciate our mental health, some things to look for, and we are going to be talking about some resources as well towards the end of the presentation. So again, my name's Tammy. I work at the Canadian Mental Health Association. I've been there for just shy of 9 years, and we are super busy over the last few years because more and more organizations, people, churches, agencies, schools are wanting to finally talk about mental well-being and mental health. So all the time I get asked the question, what is the difference between a mental illness and mental health? And typically they are very different. One definitely goes hand in hand with the other. So when we talk about what mental health looks like, I want you to think about your own personal well-being, right? Some days are good, some days are not so good. I think that's fair to say. But what I want you to think about is when our not so good days turn into weeks or months, or for some even years, it can be a mental illness, or you could be experiencing a mental health problem, right? So I want you to think about your mental health as your own personal bubble, right? Your own mental well-being. When we take a look at what mental illness is, typically we talk about a diagnosis. So just like going to an oncologist and being diagnosed with cancer, you can go to the doctor, get a referral to a mental health specialist, and get diagnosed with a mental illness. Mental illness per se is not something that you necessarily are going to be living with for the rest of your life. It really depends on the individual, on the circumstance, on the environment. There's a lot of factors that affect our overall mental well-being, and there's actually a lot of factors that can contribute to a mental illness. So I want you to think about mental illness as a diagnosable illness, just like a disease. So diabetes, cancer, heart disease, any of these things we would treat at your doctor's office, right? We would go in to see our doctor and we would get treatment. I want you to think about the same thing when we're looking at a mental illness. Having said this, not everyone reaches out to get help. When we take a look at this stat here on this slide, it says that 1 in 5 Canadians will experience a mental health problem or mental illness in any given year. I'm sure you've seen this stat before. Bell Let's Talk has been around for the last few years. There have been commercials, there's been advertisements out there, and this stat has been out for a while. When we take a look at that 1 in 5, I want you to think about how many people you actually know. Do you know 5 people? And I'm not talking about 5 people that have been diagnosed with a mental illness. I want you to think about, Do you know 5 people in general? And I'm going to say you probably do. If you count your family, if you count your neighbors, even if you count your mailman, you know 5 people, which means this is going to affect you in some way, shape, or form. So we need to think about that. Having said this, when we take a look at 1 in 5 Canadians, this represents people who actually reached out to get help, right? Someone who went to see their doctor, someone who went to see a therapist, someone who actually wanted to participate in this stat. Having said that, do you think that every person living with a mental health problem or a mental illness has reached out and got the help that they need? And the next slide talks about that. 2 in 3 people suffer in silence because they fear judgment, because they don't want to be rejected. And I want you to think about this for a second. How often have you contemplated calling in sick? How often have you contemplated sharing information with maybe a manager or someone that you work with because perhaps you were struggling? Right? People don't want the label. People don't want to be judged. People don't want to be put in a corner. So sometimes people do not reach out and get the help that they need. Having said this, I have seen great changes in the past 9 years working with the Canadian Mental Health Association. And I can tell you this, more and more people are talking about mental health. More and more people are talking about mental wellness. And more people are becoming okay with the idea or the fact that they are struggling and they're willing to get the help that they need. Now, when I talk about treatments for mental illness doesn't always necessarily mean medication, and we really need to remember that. When we take a look at our mental well-being, we need to take a look at things like our diet. We need to take a look at things like the people in our life, our environment. It may or may not include medication, but we also want to take a look at things like exercise and sleep and the people in our lives. All of these things contribute to our mental well-being. So moving on to the next slide, what I really want you to think about is being mindful. Now, what does mindful mean? Mindful means being present. Mindful means thinking before we speak. So we need to be mindful of the words that we use when we're talking to people who might have a mental health problem. Because oftentimes when we're out in the community, maybe when we're talking to friends or family, if you turn on the television, how often do you hear words like crazy? How often do you hear things like that person's bipolar, right? We throw around words sometimes without thinking about the effect it has on other people. We also sometimes say things without realizing or understanding what the other person is actually going through. The second thing on this list is talking about educating yourself. There are tons of great workshops that are available to you through cmha.ca. So when you have a chance, I want you to visit our website. I'll bring it up later on. There are workshops on mental health 101, mental health first aid. There's also suicide intervention training that might help you have a conversation with someone who's struggling. The third thing up there is keeping away from judgment. How often do we sit back and think about people and their situations and what's going on in their life, and we deem them as weak because they can't handle what's going on? What I want to remind you is that mental illness is not a weakness. Oftentimes when we think about our mental wellness, when we think about mental illness, we put weakness in the same basket. And I'm here to tell you that it's not a weakness. I'm also here to share with you that mental illness is not a choice. People don't wake up in the morning and decide to have anxiety or bipolar disorder or depression. It's not a choice. It is a medical condition. And yes, sometimes mental health issues come on through our environments or situations that come into our life. And we need to remember that as well. So when we take a look at our mental health factors, and you take a look at this slide here, we're talking about family, environmental, and individual factors. If we take a look at everything on this slide, we are looking at things like genetics, our ability to learn, our social conditions, our relationships, our parenting style. All of these things play a factor in our mental well-being. That's not to say, though, that they cause a mental illness. They affect our day-to-day lives. And sometimes, for example, our sense of belonging will affect our overall mental well-being, right? If you think about social settings like work and school, if we're not feeling like we belong, we can feel things that will affect our mental well-being. Having said that, there are specific risk factors that we need to take a look at and we need to remember. So I've listed the most common risk factors. Now, when we talk about risk factors don't necessarily mean if you're up on this list or if you experience some of these things on the list, you will definitely be diagnosed with a mental illness. They are risk factors, which means people who have these things in their pocket can possibly be more vulnerable. So the first one up there is family history. So just like cancer, just like diabetes, just like heart disease, there is a genetic predisposition to mental illness. So that is the first risk factor. When we move down the list, physical factors is also a risk factor. So sometimes people are living with physical disabilities like chronic pain, like being in a wheelchair, like getting into a car accident, not being able to work, not being able to walk. Any sort of physical disability, physical pain can be a risk factor to a mental illness like depression, which is circumstantial, which is environmental. When we take a look at substance abuse, there are tons of studies, there are tons of things that you can find online that can contribute to the next risk factor, which is substances. So there are specific substances. Marijuana is only one of them that can trigger something called psychosis. And in a nutshell, what psychosis is, it's a break from reality. Not knowing the difference between what is right and what is wrong, what is real and what is not real. Next on the list, we have traumatic life events. So we need to remember when we're supporting people, when we're having conversations with people, that what's traumatic for me might not be for you, right? And traumatic life events also vary, right? So when we think about traumatic events, you might think of 911, you might think of violent acts. But to be quite honest with you, a traumatic event could be moving to a new country. A traumatic life event could be a divorce or a separation. So these are things to consider. And then I also have on this list psychological and social factors. So a psychological factor could be something like bullying. And a social factor could be something like poverty. Both these things are going to change our environments. Both of these things are going to change our life and can have a negative effect on our mental health. So I've listed some early warning signs for you to take a look at. The first thing I want to say is that just because you've experienced some of these things on the list does not mean that you have a mental illness. You may have struggled with your mental health because of something that has happened in your life. And I will say that we've all experienced and we can all share that life happens, right? And things happen to us that can basically have us experience the things on this list. What I do want you to think about, though, is if you've experienced some of these things and they're happening often, it might be time for you to reach out and get some help. So things like sleep disturbances, sleeping too much or sleeping too little, loss of interest in things that you normally like to do, excessive fear, anxiety, or worry. So we all worry, we all have anxiety. Remember this. Every one of us experiences stress and anxiety. That is actually normal. However, when it becomes excessive, this is when it can become a problem, okay? Physical upsets. How many times have you possibly, or someone that you know, been to the doctor with a physical ailment? But then when you check things out and you have some conversations with your doctor, you realize maybe it's something going on in your personal life that is affecting your mental well-being. So an example of that would be someone who is experiencing, and I'm just giving an example, someone experiencing stress because of something in their life. Maybe they've moved, maybe they are in university and experiencing a lot of stress with all of the homework. And they go to their doctor and they are telling their doctor that they're experiencing a lot of migraines. So we have the physical ailment, we have something physical going on, but when we take a look and dive deeper, it has something to do with our overall mental well-being. The next thing up there is sadness, abuse of substances, right? So sometimes people learn to cope or self-medicate with substances because of whatever it is that they're experiencing. Some people isolate themselves. You may notice a decline in work or school performance, and then overall, the inability to cope with daily stressors. Little things in your life become harder and harder. So these are some of the early warning signs to notice. What I can say, I'm going to go back here, is we need to take a look at these early warning signs. And I also want you to remember how often these things are happening. So the rule of thumb is a mental illness is a consistent change in behavior that affects your day-to-day life. I want you to remember that. And typically, it has to be affecting your life or being consistent for 2 weeks or more. Having said this, though, oftentimes people are not going to the doctor after 2 weeks. Sometimes they're waiting months, even years, depending on their situation or their circumstance. So I've definitely given you a Cole's Notes version of what mental illness or mental health looks like. We're going to answer some questions in a bit. I also want you to reach out to me if you have any further questions or if you're looking for a workshop that's more in depth. I am putting up a list of skills that can help you when you're having a conversation, not only with your coworkers. I want you to think about your personal relationships, your kids, your family, your friends. Educating yourself definitely is up there. You're doing that now. Kudos to you for watching or joining me in this webinar. I also want you to think about the resources in your area. When I'm out in the community, many people have no idea what free available resources there are. So I'm going to show you our website in a little bit, and I want you to visit our website and find out about the resources in your area. Asking for help is up there. Oftentimes when we're struggling, we find it very difficult to ask for help. Asking for the smallest help can be very difficult. I want you to remember that you are important, and asking for help is not a big deal. And what I mean by that is, I bet if you ask for help from your family or a friend or a coworker or someone on a helpline, they will be happy to help you. The next thing on this list is listening. My favorite thing. This is something that I have learned to do with age over the past 9 years, especially as a trainer. Sometimes people don't want your advice, and I want you to remember this. Oftentimes, people are listening with the hopes that they are going to respond, right? People listen with the intent to respond instead of just listening. How often have you shared a story or something that you are dealing with, and instead of the person actually listening to your story and taking it in, they are offering advice, offering suggestions, saying something like, at least, right? It's human nature for us to want to help. So we are automatically jumping in there to give advice. I want you to just remember, and maybe try it next time in your conversations where you're not offering advice, you're just listening and taking it all in. Taking notes. So this is a suggestion that I put in here because I can share with you that I am a cancer survivor. And I will tell you that it took them over 15 months to diagnose me. I went back and forth to the doctor, and I was told that it was all in my head. I was told that I should go back home, and I would go back and forth. And eventually I became angry and frustrated because I know my body and I know I didn't feel well. So I started taking notes. And several months later, when it was time for me to get a physical, 12 months in, I showed my doctor this list of symptoms that I was experiencing. And I will tell you, from there on, they took me seriously. So the same thing applies with your mental well-being, right? Only you know your body, only you know mentally how you're feeling, right? So if you feel that you are struggling, and if you notice that it has been happening for a long period of time, 2 weeks or more, start taking notes. Maybe create a mood journal. No one has to see it, no one has to read it. Start making notes, and this is something that you can bring to your doctor so they can understand and appreciate what you've been going through. Asking for a referral is on this list because oftentimes people are going to their GP, which is their doctor, their family doctor, and getting a prescription after talking with their doctor for a few minutes. And I'm going to say that's not cool. So if you are struggling with your mental well-being, ask to see a specialist. When I had cancer, I was referred to a specialist. I saw an oncologist, and then they dealt with me moving forward. We can do the same, but we need to ask for a referral. The next one on here is remembering the person behind the illness, right? Oftentimes, we can find ourselves in a position where we can say that so-and-so is schizophrenic, or she is bipolar. I want you to think about those two statements right there. So-and-so is not schizophrenic. His name is Joe, and he has schizophrenia. A mental disorder does not define who we are, just like cancer doesn't define who I am. I've had cancer. My name is Tammy, right? The same thing applies when someone is experiencing a mental illness. So how can you help? Someone comes to you in your workplace, in your family. How can you help this person? The first thing up there is talking, having a conversation, asking questions, right? If you don't know, if you don't understand, the only way that you're going to find out is if you ask questions and you can further help them. Offering resources, which we're going to talk about in a second. And I also want you to remember, I've put up there self-care. And why does self-care help you help others? Because I'll tell you this, if you're not good to yourself, if you are run down, there's no way you can help anybody else. So take care of yourself while you're helping others. When we take a look at crisis services, I put this up here. Because oftentimes I have had conversations with people and they weren't sure what to do. So I always want people to understand that if you are stuck, if you are in a position where you're not sure what to do, you don't know who to call, remember that there are crisis services available. All you have to do is pick up a phone, your iPhone, your mobile phone, and Google crisis services, and you will find a whole bunch that come up. Now, I have listed 24/7 crisis support, PL Dufferin, because that is the agency that I'm working for. We also have access to 911. We also have access to hospitals, distress centers, and our doctor's offices when we need. All right. Now, if we take a look at this slide here, I have listed our main national website, which is cmha.ca. Here's what you can do. I know that all of us online right now are living in different places. You can visit cmha.ca and you can find your local branch. If you live in Toronto, if you live in Newmarket, if you live in Winnipeg, you can find a CMHA branch closest to you. The Canadian Mental Health Association is a national organization. We have branches across Canada, and all of our programs and services are free of charge. We are not CAMH, I just want to throw that out there. CAMH is the Center for Addictions and Mental Health, and CAMH is the hospital in Toronto. So we talked about self-care, a quick reminder that we need to be looking after our own well-being when we're supporting others. And if we want to look after our own mental health, we need to think about opportunities and things in our life that make us feel good. Things like sleep, interacting with people, learning new skills, doing things that we enjoy, spending time with the people that make us laugh, watching funny movies. We all enjoy different things, so I want you to think about a few things that you can incorporate to your daily life. So having said that, I want to thank you for having me this past half an hour. It's been fun. My information is listed here. We have our address, my phone number, and our website for CMHA PL Dufferin. And I believe here is my personal info. So Instagram, Twitter, our website, and our phone number. Are there any questions?
Thank you, Tammy.
Thank you.
That was an excellent presentation. We now open up our Q&A session. So remember, a reminder to all of our attendees, you can type your question in the chat window. So while we're waiting for people to put their questions in, one has come up here. What are some of the early warning signs of a mental health problem?
Okay, so I'm going to go back to this list here. These are some of the early warning signs. Sleep disturbances, excessive fear, anxiety, worry, physical upset, sadness, sleep disturbances, isolation. With each mental illness, there are more specific symptoms, but typically they may stir up or you may become more aware of these early warning signs beforehand.
Okay. There's another message here. Hi, Tammy. I don't have a question per se. I just wanted to thank you for your informative program this evening. Our communities need more people such as yourself providing education and awareness sessions. I'm also a mental health professional focused in the housing sector. Keep up your excellent work. And that's from Vishal Chidial from supportiveliving.ca.
Oh, Supportive Living. Yes, I work with them. So listen, you can connect with me via email. My phone number's up right now and my email's up right now. And if your organization or if you have clients that are looking for 1-hour workshops, full-day workshops, you can connect with me and I'll come out. So I will also tell you that if you're looking for any sort of training for volunteers or students or clients, we'll come out for free.
That's wonderful.
Yeah.
Well, thank you so much, Tammy. This was a great learning experience, and our attendees have, I'm sure, learned about the difference between mental illness and mental health issues. So thank you again, once again, for your time, and we appreciate everyone for attending. And we look forward to our next month's webinar on financial wellness. Thanks again, everybody, and have a great evening.
Thank you. Have a good night.